Good morning. Welcome to the weekly COVID-19 media briefing. This is Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. As of May 25th, we had 12,388 confirmed cases, including 3 from Sunday and 25 from Monday. We have 15 people hospitalized in Shasta County, including 2 who are in the intensive care unit. Our available regional ICU capacity is 44.2%, and that is for 11 Northern California counties. And we have had a total of 215,087 tests administered in Shasta County since the pandemic began. We have had 228 Shasta County residents who have died from COVID-19 in Shasta County. With us today, we have Robin Schurig. She's the director of the Public Health Branch of the Health and Human Services Agency, and Dr. Karen Ramstrom, who is our health officer. We will start with Robin this morning.
All right, thank you. I want to start, as usual, with our latest case rate and test positivity. We continue to be assigned to the red tier, along with only 7 other counties statewide. None are in the most restrictive purple tier, and meanwhile 35 are in the less restrictive orange tier and 15 are in the least restrictive yellow tier. Our case rate increased from 8.0 daily cases per 100,000 population last week to 8.2 this week. That is our adjusted rate, which was adjusted down because we have a higher testing volume than the state average. Our unadjusted rate is 9.1, up from 8.5 last week. Our test positivity also increased from 3.4% last week to 3.7% this week. And again, as long as our test positivity stays at or below 8%, then a case rate of less than 6 would qualify us for the orange tier, but we would need to meet that criteria for 2 weeks in a row before we would move to the orange. So we're now at the point where it may be possible for us to move to orange for the last week of the blueprint system before it is lifted on June 15th. However, if we don't meet the criteria for orange beginning next week, then we will continue to be in the red tier until the tiers don't exist anymore on June 15th. Again, the things that we as a community can do to help us get out of the red tier are to get vaccinated and to continue masking and distancing in order to stop the spread of disease and reduce our case rate. The latest vaccination data from the state shows that our rate of at least 1 dose among the eligible population, so those aged 12 and older, is 43.4% compared to the statewide rate of 63.1%. The number of doses administered to Shasta County residents is now at 106,445. The number of Shasta County residents fully vaccinated is 50,065, which is 33% of the eligible population. And there are an additional 15,826 people partially vaccinated, or 10.4% of the eligible population. So that's a total of 65,891 people who've received at least 1 dose, so again, 43.4%. which keeps us in the same place we were at last week, being the 12th least vaccinated of the state's 58 counties. Again, the fact that we have one of the lowest vaccination rates in the state, combined with having one of the highest case rates in the state, makes it important for us to continue to encourage people to get vaccinated, address any access barriers they may have, and help them get their questions answered and their concerns addressed. We continue to encourage people to visit shastaready.org for information, including links to reputable sources of information, and to talk with your healthcare provider if you're still unsure. We are also encouraging people to continue to be vigilant about masking and distancing. That's all I have, and I'll turn it over to Dr. Ramstrom.
Good morning, everybody. Today, I will provide an update on COVID-19 vaccine safety monitoring and just briefly touch on prevention measures going forward. We know that people have concerns about vaccine safety, which is very understandable. I thought I would review what these safety monitoring systems are and what we have learned so far. The vaccine safety monitoring systems for COVID-19 vaccine are truly unprecedented. This includes multiple existing systems as well as new safety monitoring systems implemented for COVID-19 vaccine. Nationwide, over 285 million doses of COVID-19 vaccine have been administered, in addition to tens of thousands of individuals who were in the vaccine clinical trials. So we have a lot of data on vaccine safety. We've talked about VAERS, which is a system that casts a wide net to make sure we don't miss rare events. Reports to VAERS don't mean that there was a cause and effect from the vaccine. It just identifies potential issues that can be investigated more comprehensively using these other systems. Vaccine Safety Data Link is one of these other systems. Vaccine Safety Data Link is a network of 9 integrated healthcare organizations, such as Kaiser, from across the United States that conduct active surveillance and research. The system is also used to help determine whether possible side effects identified using VAERS are actually related to vaccination, and they can compare medical conditions in people who have been vaccinated to those who have not been vaccinated. Similar data systems are used by the Department of Defense and the VA. These systems and others are also monitoring pregnancy outcomes. There's a technical work group that reviews the data from these systems on a weekly basis, and their presentations are available online. Together, these systems provide a lot of information and have helped us to learn quite a bit in just a few months' time, including the risk of anaphylaxis, which we now know is about 2.5 to 5 per million with the mRNA vaccine. It's also identified the rare yet serious condition of blood clots associated with low platelets and a plausible causal relationship of that condition with the Johnson & Johnson or Janssen vaccine, especially among young adult women. All deaths reported to VAERS are reviewed in detail, including clinical information, death certificates, and autopsy reports. No causal link to COVID-19 vaccines have been identified outside of the few deaths associated with blood clots in the Johnson & Johnson vaccine. At its most recent meeting, the Vaccine Safety Technical Work Group reported on their investigation of myocarditis among young people receiving the mRNA vaccines, concluding that most cases appear to be mild and brief, and rates did not differ from expected baseline rates. This system allows healthcare providers to be alerted to this potential concern and additional follow-up monitoring to occur. To date, no concerns about impacts on reproductive health have been identified. And lastly, I just want to speak from my heart for a moment. As Robin shared, our case rates are relatively high compared to the rest of the state and nationwide, including newly hospitalized patients. And our vaccination rates are not as high as we would like to be reassured that community transmission may be reduced. Also keep in mind that our children are not yet eligible and protected by vaccination, which is of considerable concern to our pediatricians and other providers who take care of children with COVID-19. So please, when you're not around your PA or your trusted family and friends, please take care to continue distancing. Try to be outdoors when you're engaging in activities with others, and mask when you aren't sure you're safe. And that's all I had today. Thanks.
All right. Thank you, Robin and Dr. Ramstrom. That's all we have for you today. Thank you for being with us. Enjoy the rest of your day and have a safe and healthy week.